Welcome to Munroe Regional Medical Center's nationally recognized and awarded Munroe Heart Program and to our series of introduction videos. This particular video will introduce you to some of the floors you might visit depending on your heart procedure. From all of our Munroe Heart team, thank you for watching this video on our patient stay within the heart program.
Following surgery, which can take between 2 to 4 hours, you will be brought into our state-of-the-art cardiovascular intensive care unit for recovery. You will stay here at least 1 day. In this unit, you will wake from anesthesia with a breathing tube still in place. Most patients are able to have this tube removed within 2 to 4 hours. Once the breathing tube is removed, you will be placed on either a nasal cannula or a face mask for oxygen. You will receive pain medication as needed. Some patients experience nausea and may require medication for this as well. Most patients are very sleepy and rest is encouraged during the initial recovery stage. You can have ice chips and will progress slowly to water as tolerated. You will be encouraged to continue to use the incentive spirometer, or IS, to help prevent pneumonia. Some patients may get out of bed the first day postoperatively, but most are not out of bed until the next morning. In the morning of postoperative day 1, the IV lines placed in surgery will be removed. The patient is out of bed and sitting in a chair for most of the day. Family can visit for short periods of time in this unit, but we encourage our patients to rest as much as possible here. You'll be transferred out of this unit to the step-down unit on the 4th floor to continue your recovery. Here on our 4th floor, we care for patients who may have had one of these procedures: open heart, permanent pacemaker implantation, carotid endarterectomies, lung and other thoracic procedures. On this floor, we monitor your heart rate by cardiac telemetry, the amount of drainage coming from the tube in your lungs, called chest tubes, and administer medications to control your pain. Patients receive care here until they are able to be discharged home. The staff assists you with all requirements of your recovery: managing your pain, walking, use of the incentive spirometer, how to cough effectively to clear your lungs, deep breathing exercises, and general activities of daily living. Our open heart patients are given a heart pillow to support their incision. Patients usually stay between 3 and 7 days following their procedure. The unit employs quiet time daily from 2 to 4 p.m. This allows the patient to relax or take an important nap. Rest is imperative to the recovery process of our patients. It improves their overall physical and mental well-being. Patients who have had a cardiac interventional procedure, such as a heart cath, are also admitted to monitored beds on the 4th floor. These patients may or may not have the sheaths remaining from the procedure that the staff will remove as ordered by the physician. The staff will monitor the procedure site, pulses in the affected extremity, heart rhythm, and blood pressure. You will need to be on complete bed rest and keep the procedure extremity straight. Physician orders and procedure will determine the length of time you will be on bed rest, but patients are usually discharged before 9 a.m. the next morning, with education on their medications and preventative measures on reducing their cardiac disease. When your heart is unable to pump effectively, which can be caused by many reasons, it's time to visit Munroe Heart's heart failure unit on the 5th floor. On your first day with us, we're going to evaluate your blood count, thyroid function, heart enzymes, electrolytes, and medication levels. The physician will also order a chest X-ray and an electrocardiogram, also known as an EKG. If you haven't had a 2D echo or an ultrasound of your heart done in the last 6 months, you will have that test done as well. Once on the unit, the staff will provide you with a booklet on heart failure. All of our nurses have received additional training on caring for heart failure patients and can answer any questions that you might have. If this is your first episode of heart failure, our heart failure coordinator will meet with you to answer questions. In your room is a bathroom scale, and if you are able to get up yourself, we will want you to get into the habit of weighing yourself every morning. Even after you go home, it's extremely important that you weigh yourself daily to monitor excess fluid. Equally important is that you monitor your fluid intake and output and how much sodium you are taking in every day. When your heart does not pump effectively, excessive fluid and sodium can cause an accumulation of fluid in your body. The extra fluid circulating will cause an increase in your weight and swelling in your extremities. On your dining menu, you will notice the sodium amounts so that you can track them daily. The key to living longer and better with heart failure is becoming an active member in your care. During your stay, we will be monitoring your heart rhythm, your vital signs, and according to the physician's orders, adjusting your medications. You'll be introduced to Emmy, an online education program. You will also meet with a registered dietitian and a case manager prior to discharge. Our goal is to empower you to care for yourself so that you can lead a healthier lifestyle away from the medical center.